Hello and welcome to Life IV Therapy, and welcome to your Semaglutide consultation appointment. My name is Justin, registered nurse here at Life IV Therapy and co-owner, and my job during this video is to prepare you for the visit you're about to have with either Dr. Cherfan, our weight loss physician, or one of our physician assistants. In this video, I'm going to prepare you for things to consider during your appointment and some other topics we're going to talk about for your prepared after your appointment. During the appointment, our physician or physician assistant will discuss semaglutide with you and if you're a candidate for this weight loss medication. Things to consider: have you or a family member ever had thyroid cancer? If you have, the medication may not be appropriate. Have you ever had pancreatitis? If this is true, the medication may not be appropriate. Those are two big ticket questions you must consider before the appointment, and have those questions ready for when the appointment begins. Typically, you would have already uploaded your medication list and health history into our system. If you have, excellent. If things have changed, please be prepared to notify the provider during this visit. We do want to tell you, our semaglutide is a chemically similar compounded version of what you find commercially available, known as Wegovy or Ozempic. Those are the commercially available semaglutides. There is no known generic for those medications at this time. However, due to the medication being on FDA drug shortage, we are able to obtain the medication through what we call a compounding pharmacy. Compounding pharmacies exist to provide medications to patients who have specific allergies or issues to the commercially available products. They also are used to fill in the gaps during FDA drug shortages, such as what's currently occurring with Wegovy, Ozempic, Mounjaro, and other weight loss injections. Rest assured that the medication that we're providing you is from an FDA-approved compounding pharmacy and is placed at the time of your purchase, meaning we do not stockpile the medication in the office. You will not receive an injection at this appointment. After the appointment, if the provider does prescribe semaglutide to you, an order will be placed. After the appointment, you'll be instructed to return back to the front desk of the office. At the front desk of the office, we'll discuss the cost of the medication. Currently, as of the date of this video, the current costs are as follows. However, I do caution that the cost I'm about to provide you may become irrelevant, untrue, or completely inaccurate in the future. So do discuss the current active cost with the person at the desk, or receptionist, or nurse after the visit is complete. So, as of this video's date, the current costs for our semaglutide are as follows. For 0.25, 0.5, and 1 milligram, it is $200 a month with tax. So $200 a month plus tax is the current cost for 0.25, 0.5, and 1 milligram. This includes all 4 injections and injection by the nurse. There's no additional fees at this time. For 1.5 milligrams, the current cost is $250 plus tax. And for the 2 milligram dose, the current cost is going to be $300 plus tax. Again, that is as of this video, and in the future, this information I just provided about the cost may become irrelevant or simply untrue. Now, we do provide a take-home service allowing you to take the medication home and self-administer it. There is a fee with that, and there's an additional appointment that must be prescribed. We do want to tell you that if you are thinking about taking the medication home, you will need to discuss that ahead of time, as it must be planned on the date you're going to receive your first injection, and it is a separate appointment with the nurse. So do plan to discuss that today with the receptionist at the time of purchase. To obtain your medication, you must purchase it ahead of time. We typically recommend that you purchase 2 months at a time. The reason it takes approximately 2 to 3 weeks to get the medication in. So we want to make sure that you have enough medication on hand that even with shipping delays, you still get the medication and there is no lapse. As discussed in your visit with Dr. Cherfan or a weight loss provider, you cannot go more than 14 days without the medication without potentially starting over. And you should never take it no sooner than every 6 days. So if you're someone who travels frequently or does not want to make the commute to the office every week, the take-home option may be available to you. Again, there is a small convenience fee with the take-home option, but it completely is up to you if you wish to pursue that adventure. Ordering the medication is done here at the front desk where I'm standing. You will simply talk with the receptionist and place the order. Once the order is placed, every Friday and Saturday of the week, as of this video, we will place all orders for that week, and typically they will arrive the next week. However, we still quote 2 to 3 weeks to be on the safe side, and sometimes it can take up to 4 business weeks or 20 business days to get the medication in. However, at the time of this video, we're typically getting the medication in about 5 business days, and that is always placed at the end of the week. So, place your order today. You will typically receive it the following week. Now, you may place up to 3 months of time at one time. So 3 months of medication may be placed at one time. The key of placing more orders or more months at a time is not cost savings, but allowing you to book those appointments out at a greater time. So for example, if you order 3 months of medication, you can book 3 months of appointments all at one visit. You do not have to make separate appointments, meaning you don't have to book a month, book a month and wait, as if you were to do if you purchased only 1 month at a time. So there's a huge benefit if you are someone who needs a very specific time slot. There is a big benefit to you ordering more than 1 month at a time. Again, there is no cost savings, but again, you are able to book out those additional appointments a little bit easier. Speaking of cost savings, currently as of this video, we offer the self-care coupons, 1 coupon per month of semaglutide purchase. These self-care coupons are at $10 off any of our massage or aesthetics with Sam, our licensed medical esthetician, that can be applied at those visits. These are stackable, so if you purchase 3 months of semaglutide, you receive 3 coupons. You could essentially apply all 3 coupons to 1 visit if you wish. These coupons are not redeemable for cash or any other offer. Once the medication has arrived in the office, so after you've placed the order and has shipped and arrived, our receptionist will give you a call to notify you the medication is in. If she makes contact, she'll discuss with you over the phone and schedule those appointments. If she does not make contact with you, she will leave you a voicemail. You need to give us a call back so we can get those appointments scheduled. Again, if you're planning on taking it home, please remind the person that's calling you that you want to schedule a take-home appointment. These appointments are different and there is a convenience fee associated with that appointment type. If you're going to come in weekly, what you can expect is roughly a 5-minute appointment where you come in, the nurse obtains your weight, and an injection is given. The injections, as discussed in the previous appointment, are given in the back of the arm, the belly, or the thighs. Again, it is up to you, and when you discuss with the provider where you'd like to inject them, ultimately it doesn't make much of a difference. These appointments take approximately 10 to 15 minutes at the most, usually less, but that's what we plan for. Again, if you need a specific time slot, I urge you to order more than 1 month at a time for you can get those time slots, because some of the early mornings and late afternoons are very tough to get. Other than that, that is really what you need to know from our end here at Life IV Therapy when it comes to semaglutide. Make sure you're following the calorie restriction that's been provided at the visit, which you'll discuss here in a little bit, and make sure that you discuss with the nurses and the team here any questions you have with scheduling, ordering, and things of that nature. Again, thank you so much, and I hope you enjoy your visit here with one of our weight loss providers. And again, feel free to ask any questions that you have. It's a wealth of knowledge. And welcome to the semaglutide weight loss warriors, as we'll call it, or our weight loss family. And I hope you have continued success with your weight loss. Again, if you have any questions, feel free to ask anyone on our team, and you can also see our providers at any time just by asking. So thank you again, and welcome to our lovely weight loss family. Thank you.